Hello, this is Derek Polson with Aspen University, Foundations of Nursing Practice, Nursing 110, Professor Jane Cheek, DNP, for assignment Module 6 regarding the SBAR. SBAR is a tool used by healthcare professionals that describes the situation, provides a background, provides client assessment, and then the nurse will make a recommendation to the doctor. There are guidelines for communicating with physicians using SBAR. First of all, use the following modalities according to physician preference: direct page, if known, physician's call service, during weekdays, physician's office directly, and on the weekend and after hours during the week, the physician's personal phone. Prior to calling the physician, you're going to want to ask, have I seen and assessed the patient before calling? Has the situation been discussed with the resource nurse or preceptor? Review the chart for appropriate physician to call. Know the admitting diagnosis and date of admission. And have I read the most recent MD progress notes and notes from the nurse who worked the shift ahead of me? And have the following available when speaking with the physician: patient's chart, list of medications, allergies, any IV fluids given, and labs, most recent vitals, reporting labs results, provide the date and time the test was done, and results of previous tests for trending and comparison. For this assignment, this student nurse chose scenario 1, which is Mr. O is a 63-year-old who was dizzy and lightheaded, at home and almost fell. His wife brought him by car to the ER. Mr. O was admitted to AMU with syncope. This is not his first time being admitted to the hospital. He has been treated in the past for congestive heart failure and acute myocardial infarction. Feels like he is pretty healthy as he only takes NSAIDs at home for chronic back pain. Mr. O got to AMU at 1600. His nurse Jenny assessed him and found his blood pressure to be 138/84, pulse of 76 and regular. His respiratory rate was 16, and he is afebrile at 98.6. Mr. O's labs were normal, but his IV infiltrated during transport, so Nurse Jenny started a new IV and put a warm compress on the old site. Nurse Jenny reported off to Ben, Nurse Ben, at 1900. At 2130, PCA found Nurse Ben, and told him that he had just helped Mr. O get off the bedpan. Mr. O had a large black tarry stool and was complaining of not feeling well. Nurse Ben went in to assess Mr. O. His vital signs were blood pressure 94/66, pulse 114, and respiratory rate of 24. His pulse ox was 97 degrees. And he was pale and his skin was clammy. Nurse Ben asked him how he was feeling. Mr. O said he just didn't feel well and could not get comfortable. He asked if he could have something for his belly. It is really hurting, he stated. And Nurse Ben assessed his abdomen and found that it was distended, and Mr. O had diffuse abdominal pain, which he rated as a 6 on a scale of 1 to 10. I am now going to provide an example of using the SBAR tool when calling a physician.
Hello, this is Dr. Aaron.
Situation. Hi, Dr. Aaron. This is student nurse Derek calling from the emergency department in regards to patient Mr. O in room 1. Mr. O presented to the ED POV at 1600 after experiencing dizziness and syncope. After assessment at 2130, Mr. O's vitals and appearance are declining, and black tarry stool was found. Background. Upon initial assessment, Mr. O was found to have vitals within normal limits. Labs were normal. The patient was afebrile. Mr. O has a history of CHF, MI, and back pain, for which he takes NSAIDs, and otherwise he feels healthy. Mr. O's current vital signs are blood pressure of 94/66, with a pulse of 114, respiratory rate of 24, and pulse ox at 97%. Mr. O is pale and clammy. Stomach is distended with diffuse abdominal pain at a level of 6 out of 10. Assessment. Based on Mr. O's vital signs, physical appearance, and black tarry stools, it is this student nurse's opinion that Mr. O has an upper gastrointestinal bleed. Recommendation. This student nurse is recommending lab work and imaging to rule out or confirm a GI bleed.
I agree with your assessment and will order IV fluids, lab work to include complete blood count, CBC, as well as CT and endoscopy. Please educate the patient about the use of NSAIDs and risk of GI bleeds, as well as inform me immediately if there are any changes to the patient's condition.
Okay, thank you, Dr. Aaron. And I will speak with the patient and educate Mr. O on the use of NSAIDs and bleeding factors. Classroom debriefing. The clinical scenario appears to be a clear-cut case of gastrointestinal bleed. A drop in blood pressure and increased heart rate would lead one to consider loss of blood or hypovolemia. Add in the patient's physical appearance as pale, clammy with stomach distension, abdominal pain, and associated tarry black stool. A nurse or other healthcare provider should immediately consider GI bleed. What should have been added to the SBAR scenario? A medication reconciliation list should have been included, as it can aid in determining root cause of illness. The scenario did not include a list of current medications besides NSAIDs. The MedRec list would help, as other medications can also increase the risk for GI bleed, such as corticosteroids, selective serotonin reuptake inhibitors, SSRIs, and antiplatelet drugs. Lab results should have also been included. Even though they were described as normal, if levels are borderline, it can make a healthcare provider think about what might be going on, or to order further testing as testing directed at the borderline results. This student nurse believes that the conversation went well. But with that being said, like most situations and conversations, anything can always be improved upon. This student nurse believes that the SBAR was presented effectively to the physician according to the scenario provided. The situation was described as well as patient background history. This student nurse assessed the patient and informed a diagnosis of gastrointestinal bleed. Lastly, the student nurse provided a recommendation for patient testing and provided feedback to doctor to inform her if change in patient condition. The SBAR is a great tool for nurses and other healthcare providers to be able to provide the best patient care for best outcomes possible for the patient. Thank you.